As I introduced you, I certainly am convinced of your qualifications for this and don't feel any less after your opening statement. Dr. Gupta, thank you, not just for aspiring to this important position, but for your life's work. As we said in our telephone conversation, I was struck by the fact that you didn't head to the bright lights in your life, you headed to the communities that needed your help, and many times chose rural areas and parts of this country that others might not have chosen in your determination to deal with the drug crisis we currently face and one we have faced over the years. There are two things that I want to make a comment on and ask your reaction to. One, there are many people to blame for the opioid epidemic, and I am not taking away any of the responsibility that they had. But there are two areas that I think have been overlooked. Despite the growing evidence of the addictive nature of opioids, many people in your profession, the medical profession, continued to prescribe these in vast quantities. Some of them were clearly with criminal intent, but others seemed to be with indifference to whether or not the person became addicted to the product, when a conscientious doctor following that patient would have realized it over some period of time. But the drug salesman, whatever other influences were involved in that, pushed many of these doctors to continue to prescribe opioids in indefensible amounts, even after we knew that they were addictive. I'd like your comment on that. And the second one I mentioned to you, it was in this room 6 or 7 years ago where I discovered the role of the Drug Enforcement Agency, which has to approve the annual quota of production for opioid products. They were authorizing at pharma's request, let me underline that, at pharma's request, amounts of those drugs to be produced each year way beyond any of the needs of medical practice. They were clearly setting them up to be part of an illegal, sometimes criminal undertaking in selling these drugs in quantities. Tell me what you think about those two elements and what you're going to do about them.
Thank you, Mr. Chairman. Both are very important questions. I have worked very closely, as you are aware, and maybe aware, that West Virginia was amongst the worst hit in terms of shipping of hundreds of millions of opioids into the small state of about less than 2 million people. We've worked very hard across jurisdictions, across the state, as well as in a multidisciplinary and multifaceted manner. I was very happy to see that our reduction in the supply and prescribing of opioids far exceeded many other jurisdictions across the United States, but it takes a lot of effort. There is no doubt that there are doctors who have ill intent in prescribing what I call bad docs. There's also no doubt that there's a lot of other doctors who have been told or otherwise been believed that it's a good idea without having scientific evidence at the time. We still have more other physicians who have just overprescribed. So it's been a problem of volume, it's a problem of diversion, and I think it's going to take us time to get there, but we must also make sure that as the pendulum swings, we also take care of the people who have legitimate pain. At the same time, the DEA, I agree that that there is a lot of work we still need to do, and if I'm confirmed, you have my commitment to working on both of those aspects.
In our conversation, I also noted the fact that there's been a dramatic change and shift in our feelings about addiction. Sad to say, 15 or 20 years ago, if you said someone overdosed last night, who do you think they are and where do they live? You'd say, I'm going to guess African-American, 30 years old, inner city. And you would have been right. Not so anymore with opioids and heroin and fentanyl and things that are being used now more frequently. Those have affected that white cheerleader girl in the suburbs, and it's her family that comes forward heartbroken and learns that she's overdosed and dead as a result of it. And I think it's forced us to really throw out the stereotypes and look at addiction as a medical problem, not just a failure of moral purpose, but a medical problem. Do you sense that change in conversation as well?
Yes, Mr. Chairman, I hope my being here today as a nominee reflects both the President's focus on this as a public health crisis which it truly is, which is going to require a lot more than just one aspect. So we have to take all of the tools in our toolbox to act, but it's clearly a public health crisis.
I can't think of a better introduction than to have those two senators from West Virginia and their glowing praise of your work. I'm glad you're taking on this job. And Ms. Prelogar, it's no reflection on you that I directed my questions to Dr. Gupta. I'm for you all the way. Senator Grassley.